You are counseling a client whose dog has been diagnosed with diabetes. The client seems overwhelmed and unsure about the treatment options. What is the best approach to explain the diagnosis and treatment plan to the client while addressing their concerns? Answer: when counseling clients about a diagnosis, especially one that can be life-altering like diabetes in a pet, it's important to follow a structured approach that emphasizes empathy and clear communication. Here's a strategy to adopt. Understand the client's emotions. Start by recognizing and acknowledging the client's emotional state. Use phrases like, "I can understand this is overwhelming." Simplify the diagnosis. Use simple, non-technical language to explain the condition. For example, diabetes occurs when the pancreas doesn't produce enough insulin, which is important for regulating blood sugar. Offer treatment options clearly. Present the treatment options in a way that aligns with the client's lifestyle. Break down the options: medication, insulin injections, dietary changes, and exercise routines. Make sure to address any concerns such as cost or effort involved in managing the condition. Provide educational materials. Offer brochures or infographics that outline the condition and care protocols. These help clients process information at their own pace. Support and follow-up plan. Reassure the client that diabetes can be managed effectively with treatment. Discuss follow-up visits, ongoing blood tests, and adjusting treatment if necessary. You are managing the schedule at a busy veterinary clinic and notice that clients frequently experience long wait times, leading to frustration. What steps should you take to optimize the appointment scheduling process and improve client satisfaction? Answer: optimizing the appointment scheduling process involves several key strategies to improve client flow and minimize wait times. Assess appointment types and duration. Start by reviewing the average time required for each type of appointment, e.g., wellness exams, sick visits, surgeries. Ensure that longer appointments, such as surgeries or complex treatments, are allotted enough time, while routine checkups or follow-ups are scheduled more quickly. Use software for efficient scheduling. Implement or optimize the use of scheduling software that allows for real-time booking, automatic reminders, and efficient allocation of resources. Ensure that the system accounts for peak hours, adjusting the number of appointments accordingly. Implement buffer times. Schedule buffer periods between appointments to allow for unforeseen delays or client consultations. This helps in avoiding the cascading delays that can result from back-to-back scheduling. Train staff on time management. Proper training for technicians and administrative staff is essential to ensure they understand the importance of sticking to the scheduled times. This helps to avoid disruptions that lead to delays. Client communication. Proactively communicate with clients about expected wait times. Offer flexibility for clients to reschedule if they are unable to wait, or provide alternative times. Relevant guidelines. The American Animal Hospital Association (AAHA) suggests that practices should regularly evaluate their scheduling systems to improve operational efficiency while maintaining a client-centered approach to minimize dissatisfaction. A client has just lost their pet due to euthanasia and they are visibly grieving. How should you, as an animal health technician, handle this situation to provide appropriate support during this difficult time? Answer: handling grief with empathy and professionalism is crucial in these sensitive situations. The following approach can help provide comfort to the grieving client. Acknowledge the grief. Begin by acknowledging the client's pain. Phrases like "I'm so sorry for your loss" show empathy and understanding. Don't rush the grieving process. Provide emotional support. Create a safe, non-judgmental space for the client to express their feelings. Offer tissues and allow them time to talk. Sometimes just listening is the best form of support. Explain the process. If necessary, gently explain the steps involved in the euthanasia process and what the client can expect afterward, e.g., cremation or burial options. Some clients may find comfort in knowing that the procedure was done with care. Offer grief resources. Provide information on pet loss support groups or professional counseling services. Many clinics have partnerships with local pet loss support organizations. Follow up. A follow-up message or call after a few days can show that the clinic cares about their well-being beyond the immediate event. You notice that a critical pharmaceutical product used in treatments is running low and may not be available in time for upcoming procedures. What steps should you take to manage the inventory and avoid disruptions in patient care? Answer: effective inventory management is vital to ensure that necessary supplies and medications are always available for patient care. Here's what you should do. Monitor inventory regularly. Implement a system for tracking stock levels and setting reorder points. Use inventory management software to track usage patterns, which can help predict future needs based on patient volume and historical data. Communicate with suppliers early. As soon as you notice a product running low, contact the supplier immediately to arrange for expedited delivery. If the supplier is unable to fulfill the order, quickly consider sourcing the product from another supplier. Identify substitute products. Have a list of acceptable alternatives for critical medications and supplies. Ensure these substitutes are clearly documented and readily available so treatments are not delayed. Educate staff on inventory procedures. Train your team to report low stock levels promptly rather than waiting until supplies are completely depleted. Additionally, staff should know the procedure for prioritizing stock for critical treatments. Review inventory turnover. Regularly assess inventory turnover rates to determine if there are inefficiencies in stockpiling or excess purchases. Mr. Thompson has brought his pet, Bella, in for a routine checkup. During the appointment, he insists on having multiple procedures performed in a single visit, even though the clinic typically handles them in separate appointments for time efficiency. How should you handle Mr. Thompson's request to ensure the clinic runs smoothly and the pet receives the necessary care? Answer: to address Mr. Thompson's request while maintaining clinic efficiency, follow these steps. Assess the medical need. First, assess if all the procedures Mr. Thompson requests are medically necessary during the visit. Discuss the importance of each procedure and explain the potential benefits and risks of performing them all at once. Clarify clinic policies. Politely explain the clinic's policy for separating procedures to maintain quality care and ensure the staff can dedicate adequate time for each treatment. Use a non-confrontational tone, such as, "For Bella's safety, we typically separate these treatments to ensure we have the proper time and attention for each one." Offer an alternative. If the procedures are necessary, propose an alternative approach, such as scheduling a follow-up appointment for the additional procedures. Offer to accommodate the client as best as possible while maintaining the clinic's operational standards. Communicate cost implications. If there are additional costs associated with performing multiple procedures, ensure the client is informed of these before proceeding. Document the client's request. Document Mr. Thompson's request and your response in the pet's medical record to ensure transparency and avoid misunderstandings. What are the key considerations when creating educational materials, e.g., brochures and infographics, to help clients understand common health conditions their pets may face? Answer: creating effective educational materials involves clarity, accessibility, and relevance. Here's how you can design these materials. Simple, clear language. Avoid medical jargon. Use layman's terms to ensure the material is understandable. For example, instead of neoplasia, use abnormal growths or tumors. Use visual aids. Infographics, illustrations, and charts can enhance understanding. Visuals are especially helpful when explaining complex processes, such as how a disease progresses or how medications work. Tailor the content to the audience. Consider the client's level of knowledge and the pet's condition. Tailor the content accordingly. For example, an infographic for a dog with arthritis might show the stages of the condition, treatment options, and lifestyle adjustments. Provide actionable advice. Include clear steps for treatment or care at home. Ensure the material empowers clients with knowledge and the tools they need to care for their pet. Ensure accessibility. Consider language barriers and provide translated materials if necessary. You might also want to offer digital versions of brochures for easy access on mobile devices. You need to explain a treatment plan for a pet suffering from heart disease, which involves medication and lifestyle changes. How should you present this information to the owner to ensure compliance? Answer: to ensure compliance, break down the treatment plan into clear, manageable steps. Simplify the treatment plan. Explain each step of the treatment plan, e.g., medication dosage, frequency, and potential side effects in simple terms. For instance, Bella needs this medication twice a day, and we will monitor her progress with monthly checkups. Discuss lifestyle changes. Clearly outline the necessary lifestyle changes, such as diet modification and exercise restrictions. Provide practical tips for incorporating these changes into the pet's daily routine. Address concerns. Ask the client if they have any concerns or questions. Address any possible barriers to compliance, such as difficulty administering medication, and offer solutions, e.g., using a pill pocket or liquid form. Provide written instructions. Provide a written care sheet with treatment instructions and key reminders. This will help the client refer to it as needed. Emphasize follow-up care. Reassure the client that follow-up visits are essential for monitoring progress. Remind them of the importance of these checkups to adjust the treatment plan as needed. You are managing a team of veterinary technicians, and there is a disagreement between two team members about their roles in a specific procedure. How should you handle this situation to resolve the conflict and ensure that the procedure is performed smoothly? Answer: listen to both sides. Start by giving each team member the opportunity to explain their perspective. Ensure that the conversation remains professional and focused on the procedure. Clarify roles and responsibilities. Review the roles and responsibilities related to the procedure. Clearly define each technician's duties to prevent overlap and confusion. Find a compromise. If there is room for flexibility, work with both team members to find a solution that addresses their concerns while ensuring that the procedure is performed efficiently. Reaffirm teamwork. Emphasize the importance of teamwork and collaboration in providing the best care for the animals. Reinforce that each role is important and valued. Document the resolution. After resolving the issue, document the discussion and outcome to prevent future misunderstandings. Relevant guidelines. The AVMA and National Association of Veterinary Technicians in America (NAVTA) both highlight the importance of clear communication and role clarity within veterinary teams to ensure effective and efficient care. When designing a new veterinary clinic, what considerations should be made to ensure a safe, efficient, and client-friendly environment? Answer: a well-designed veterinary clinic maximizes workflow and enhances client satisfaction. Here are key factors to consider. Patient flow. Design the clinic layout to ensure smooth patient flow. Separate areas for waiting, examination, treatment, and recovery help prevent cross-contamination and ensure that each patient receives the appropriate care. Client privacy. Consider incorporating private consultation rooms where clients can discuss sensitive matters without interruptions or exposure to other clients. Staff efficiency. Design workspaces that promote teamwork and easy access to necessary equipment. Ensure that essential areas, e.g., pharmacy diagnostic room, are easily accessible for staff. Safety protocols. Adhere to OSHA and AVMA guidelines for workplace safety, such as using non-slip floors, appropriate waste disposal, and proper ventilation in areas where hazardous materials, e.g., anesthesia gases, are used. Client comfort. Ensure the waiting area is comfortable and welcoming. Offer seating, reading materials, and clear signage to guide clients. Mrs. Walker is unsure whether to pursue surgery for her cat's fractured leg. She is concerned about the cost, the recovery time, and whether surgery will give her cat a good quality of life. How should you address her concerns and help her make an informed decision? Answer: acknowledge her concerns. Start by validating Mrs. Walker's concerns. For example, I understand that this is a difficult decision and that you're thinking about what's best for your cat, but discuss the options. Explain the pros and cons of surgery, including potential outcomes, risks, and recovery time. Discuss the potential for a successful recovery and the impact surgery might have on her cat's long-term quality of life. Provide cost information. Be transparent about the costs involved and provide a breakdown. If applicable, discuss payment plans or pet insurance options. Offer alternatives. If surgery is not the only option, explain other treatments, such as splinting, and their likelihood of success. This allows Mrs. Walker to make a more informed decision. Provide educational materials. Provide her with information or brochures about the procedure, expected recovery process, and what she can expect post-surgery. Encourage follow-up. Offer to answer any further questions and arrange for follow-up consultations after Mrs. Walker has made her decision. Explain the difference between core and non-core vaccines for dogs. How should an animal health technician decide which vaccines are necessary for a specific patient? Answer: core vaccines are those recommended for all animals of a species due to their high risk of disease severity, prevalence, and zoonotic potential. For dogs, examples include rabies, canine distemper, canine adenovirus, CAF2, and canine parvovirus, CPV2. Non-core vaccines are optional and tailored based on the animal's lifestyle, geographic location, and exposure risks, such as the Bordetella bronchioseptica and Leptospira vaccines. When determining the necessary vaccines, patient evaluation, assess age, breed, health status and vaccination history, lifestyle and risk assessment, evaluate exposure risk to wildlife, boarding frequency and local prevalence of diseases. Guidelines. Follow professional guidelines such as those from the AAHA, American Animal Hospital Association, or the World Small Animal Veterinary Association (WAVA). Client education. Explain the importance of both core and non-core vaccines and potential adverse effects. Relevant guidelines. WSAVA vaccination guidelines recommend considering core vaccines as the foundation of disease prevention. Why is the judicious use of antibiotics critical in veterinary practice, and what steps can a technician take to ensure compliance with antimicrobial stewardship? Answer: judicious use of antibiotics is essential to combat antimicrobial resistance (AMR), which poses a significant threat to public health, animal health, and the environment. Misuse of antibiotics can lead to the development of resistant bacterial strains, reducing treatment efficacy. To ensure compliance with antimicrobial stewardship, diagnostic testing, support culture and sensitivity testing before prescribing antibiotics, education, educate clients on the importance of completing prescribed courses and not using leftover medications, alternative strategies, promote infection prevention, proper wound care, and the use of probiotics where appropriate, regulatory compliance. Follow legal frameworks like the FDOS Veterinary Feed Directive (VFD) for food-producing animals, dosage precision, use precise dosing and minimize off-label usage unless justified by the veterinarian, relevant guidelines. The AVMA, American Veterinary Medical Association, promotes a One Health approach to antimicrobial use. Mrs. Parker's dog, a 3-year-old Labrador, regularly hikes in wooded areas. During an annual visit, Mrs. Parker mentions that she found a tick on the dog 2 weeks ago. The dog appears healthy, but Mrs. Parker is concerned about Lyme disease. What steps should the technician take to address the situation? Answer: risk assessment. Obtain a detailed history of exposure including recent travels and hiking locations. Clinical examination. Check for signs of Lyme disease such as lethargy, fever, or joint swelling. Diagnostic testing. Recommend testing for Borrelia burgdorferi via serology GE, LISA or SN, AP forks. Preventive measures. Discuss year-round tick prevention using products like fluorolana or selamectin. Client education. Educate Mrs. Parker about environmental control measures including landscaping techniques to reduce tick habitats and prompt tick removal using appropriate tools. Vaccination. If the dog is Lyme disease negative and at high risk, consider a Lyme vaccine. Relevant guidelines. CDC and CAP, Companion Animal Parasite Council, guidelines recommend routine tick checks and preventive strategies. Describe the principles of positioning for a lateral thoracic radiograph in dogs. What are the key steps to ensure diagnostic quality? Answer: patient preparation. Ensure the animal is calm and sedated if necessary. Remove collars or metallic objects. Positioning. Place the dog in a lateral recumbent position with the affected side down. Extend the forelimbs cranially and hindlimbs caudally to prevent overlap of the sternum and spine. Ensure the thoracic spine and sternum are equidistant from the table. Collimation. Include from the thoracic inlet to the diaphragm. Markers. Place a lateral marker indicating the side closest to the table. Exposure settings. Use appropriate KVP and mass settings for the size and density of the thorax. Quality check. Verify that the ribs and vertebrae appear as crisp and distinct outlines without motion artifacts. Relevant guidelines. ACVR, American College of Veterinary Radiology, recommends standardized positioning techniques for consistency. What are the differences between barium and iodine-based contrast agents, and when should each be used in veterinary diagnostic imaging? Answer: barium-based contrast, used primarily for gastrointestinal studies, e.g. esophagram upper GI studies. Advantages: excellent coating properties, providing detailed mucosal imaging. Contraindications: should not be used if perforation is suspected due to the risk of peritonitis. Iodine-based contrast, used for vascular imaging, urinary tract studies, and in cases where perforation is suspected. Advantages: water-soluble and safe for intravascular or intrathecal administration. Disadvantages: may cause allergic reactions in some patients. Relevant guidelines. Refer to ACVR protocols for contrast agent selection based on suspected pathology. What quarantine protocols should be implemented in a veterinary clinic to control an outbreak of canine parvovirus? Answer: in the event of a canine parvovirus outbreak in a veterinary clinic, strict quarantine protocols are essential to prevent further transmission. Initially, any suspected or confirmed cases should be immediately isolated in a designated isolation area equipped with proper ventilation to avoid cross-contamination. The isolation area should be marked and access limited to essential personnel only. Personal protective equipment (PPE) like gloves, gowns, boot covers, and masks should be worn by staff entering the isolation area to reduce the spread of the virus. Disinfection is crucial. Use of virucidal disinfectant such as bleach 130 dilution, which is effective against parvovirus. Staff should be educated on proper hygiene practices, such as frequent hand washing and avoiding touching their face. Exposure monitoring for other animals in the clinic should be conducted for at least 14 days, and animals should be vaccinated if needed. Finally, communication with clients about the outbreak should be transparent and timely while respecting patient confidentiality. Following guidelines set by the AAHA Infectious Disease Management ensures that the clinic remains compliant and effectively manages the outbreak. Why is it essential to use personal protective equipment (PPE) in veterinary radiography, and what are the key components of effective radiation safety? Answer: in veterinary radiography, using personal protective equipment (PPE) is crucial to minimize radiation exposure and protect staff, patients, and others in the vicinity. Radiation safety standards are enforced by organizations like the Nuclear Regulatory Commission (NRC) to ensure safe practice and compliance with limits on exposure. Key components of radiation safety include lead aprons and gloves. These protect vital organs from scattered radiation during imaging procedures. Lead is the most effective material for shielding against X-rays. Thyroid shields. These shields protect the thyroid gland, which is highly sensitive to radiation. Dosimetry badges. These badges monitor the cumulative radiation exposure of staff, ensuring it stays within safe limits. Maximizing distance. Radiation exposure decreases with increasing distance from the source. Whenever possible, personnel should stay at least 6 feet away from the radiation beam. Protective barriers. Use lead-lined barriers in the radiography room to provide additional protection when staff cannot avoid being near the radiation source. What are the primary methods for controlling mosquito-borne diseases in dogs, and why is integrated pest management critical? Answer: controlling mosquito-borne diseases in dogs, such as heartworm disease, requires a multifaceted approach that combines preventive medication, environmental control, and integrated pest management (IPM). Preventive medications. Administer heartworm preventatives like ivermectin or milbemycin on a regular schedule as prescribed. These medications prevent larvae from maturing into adult worms in the dog's heart and lungs. Environmental control. Reduce mosquito breeding sites by eliminating standing water in outdoor areas where mosquitoes breed. This includes emptying containers, cleaning gutters, and using water treatments like larvicides in ponds, mosquito repellents and barriers. Use mosquito repellents that are safe for pets or keep pets indoors during peak mosquito activity periods, dawn and dusk. Consider mosquito nets for outdoor areas or kennels. IPM, integrated pest management, combines chemical treatments, larvicides, biological control, introducing natural predators of mosquitoes, and environmental modification, removing breeding sites. This holistic approach is more sustainable and reduces reliance on pesticides, minimizing the risk of resistance development in mosquito populations. How does ultrasound differ from radiography in evaluating soft tissue injuries in dogs? Answer: ultrasound and radiography are both essential tools in veterinary diagnostic imaging, but they serve distinct purposes, especially in evaluating soft tissue injuries. Ultrasound. Unlike radiography, ultrasound uses sound waves to produce real-time, high-resolution images of soft tissues such as muscles, tendons, ligaments, and internal organs. It is especially useful for detecting fluid accumulations such as hematomas, effusions, and abscesses. Ultrasound also helps assess the condition of soft tissues by analyzing their echotexture, the density and appearance of tissues. This is particularly important in diagnosing injuries such as muscle tears or tendon ruptures, which radiographs cannot effectively reveal. Radiography. While excellent for visualizing bones and skeletal structures, radiography is not as effective for soft tissue evaluation. It primarily captures density differences in tissues, and while it can detect some soft tissue changes like large masses or fluid buildup, it is less sensitive than ultrasound for fine structural changes. Ultrasound offers the advantage of dynamic evaluation, allowing practitioners to observe real-time motion in joints or the heart, providing a deeper understanding of soft tissue health. Explain why maternal antibodies can interfere with puppy vaccinations and how this affects the vaccine schedule. Answer: maternal antibodies are transferred from the mother to the puppy through colostrum during the first 8 hours after birth. These antibodies provide passive immunity and protect the puppy against infectious diseases during the early weeks of life. However, maternal antibodies can interfere with the effectiveness of vaccines administered to puppies, as they may neutralize the antigens in the vaccine, preventing the puppy's immune system from producing a sufficient immune response. The timing of vaccination is crucial to avoid this interference. Maternal antibodies typically begin to decline between 6 and 16 weeks of age. The exact timing can vary depending on the puppy's breed, the mother's antibody levels, and environmental factors. This is why puppies are vaccinated multiple times during the first few months to ensure that at least one dose is administered after maternal antibodies have waned enough for the vaccine to take effect. A typical vaccination schedule for puppies involves administering the first vaccine at 6-8 weeks of age, followed by boosters every 3-4 weeks until the puppy is 16 weeks old. This ensures that the puppy is protected against diseases like canine distemper, Parvovirus and adenovirus once maternal antibodies are no longer active. Explain the importance of maintaining a sterile field during surgery. What are the potential consequences of breaking sterility and how can it be avoided? Answer: maintaining a sterile field is critical in preventing surgical site infections. Sterility ensures that the surgical area, instruments, and environment are free from pathogens that could cause infection. Breaking sterility introduces microorganisms that may lead to delayed healing, increased patient morbidity, higher treatment costs due to prolonged care or additional interventions. To avoid breaking sterility, only sterile instruments should enter the sterile field. Use proper scrubbing, gowning, and gloving techniques. Limit unnecessary movement and talking near the field. Ensure appropriate sterilization of instruments and draping of the patient. Relevant guidelines. The Centers for Disease Control and Prevention. What is the role of the surgical nurse in maintaining a sterile field during a procedure, and how does the scrub method contribute to infection control in the operating room? Answer: the surgical nurse plays a crucial role in maintaining the sterile field during surgery. This includes ensuring that all sterile items are prepared correctly, monitoring the environment for contamination, and assisting with the proper scrubbing and gowning techniques. The scrub method is essential for infection control as it involves thoroughly washing hands and forearms using an antiseptic solution to reduce microbial contamination. The surgical nurse must also follow strict aseptic techniques when handling instruments, dressing, and assisting the veterinarian. Guidelines for surgical aseptic techniques are provided by the Association of Veterinary Surgical Technicians (AVST), which emphasizes the importance of proper hand hygiene and sterile field maintenance to prevent surgical site infections. Scrubbing methods usually involve a timed scrub, g 510 minutes, and the use of a surgical scrub brush, ensuring all areas of the hands, wrists, and forearms are clean. This is critical because any breach in technique can lead to contamination and post-surgical infections. It is important that the scrubbed individual does not touch non-sterile surfaces and that their movements remain controlled to prevent the introduction of contaminants. Explain the key differences between the types of forceps used in surgery and provide examples of when each type should be used. Answer: forceps are surgical instruments used to grasp, hold, or manipulate tissues and are categorized into two types: thumb forceps and tissue forceps. Thumb forceps. These are typically used for delicate tissue handling and to clamp small blood vessels. They are held like a pencil between the thumb and the index finger. Adson forceps, a common type of thumb forceps, have fine tips and are used to handle delicate tissues such as skin and blood vessels without causing damage. Tissue forceps. These are used for heavier tissue manipulation and to clamp tissues for longer periods. Dressing forceps are commonly used to pick up and apply dressings, while Kelly forceps and Cryle forceps are used to occlude blood vessels or tissues during surgery. Each forceps type is designed to suit a specific task, with the distinction often being related to the width and grip of the jaws. Forceps with finer tips are used for more delicate tasks, while heavier forceps are used to clamp or manipulate thicker tissues. Proper use and handling of these instruments are governed by the AVST surgical guidelines to prevent tissue damage and to maintain sterile procedures. When closing a surgical wound, what considerations must a veterinary technician make when choosing between absorbable and non-absorbable sutures? Answer: choosing between absorbable and non-absorbable sutures depends on several factors, including the nature of the wound, the tissue involved, and the desired healing outcome. Absorbable sutures are ideal for internal wounds that will heal without the need for the suture to be removed. They are broken down by the body over time, thus eliminating the need for surgical removal. These sutures are commonly used for deeper layers of tissue where the suture is not easily accessible or necessary to remove. On the other hand, non-absorbable sutures are used for external wounds or those that require additional strength and need to be removed later. These sutures are typically used in areas where long-term tensile strength is required, such as in skin closures, as they remain in place until the healing process is complete and can be safely removed. Veterinary technicians must also consider the specific material characteristics, such as monofilament versus braided sutures, and the risk of infection. Non-absorbable sutures like nylon are known for their strength and resistance to infection, whereas absorbable sutures like Vicryl or catgut are often chosen for their ability to be absorbed and not require removal. MS. Thompson is preparing for a routine spay procedure in a veterinary clinic. She is responsible for setting up the sterile field and assisting with the procedure. As she is preparing, she accidentally touches the outside of a sterile instrument tray with her gloved hands. What steps should MS. Thompson take to maintain aseptic conditions and prevent contamination during surgery? Answer: in this scenario, MS. Thompson must recognize the potential breach in sterile technique and act quickly to minimize the risk of contamination. The following steps should be taken. Alert the team, MS. Thompson should immediately inform the surgeon and the surgical team about the contamination. Communication is vital in ensuring that all team members are aware of the breach and take the necessary precautions. Dispose of the contaminated items. The instrument tray that was touched should be considered contaminated and disposed of if it cannot be decontaminated by the surgical team. A new sterile instrument tray should be prepared. Re-scrub hands and gloves. MS. Thompson should re-scrub her hands and change her gloves to prevent the spread of contamination. The AVST surgical guidelines recommend that if there is any uncertainty about maintaining sterile technique, it is safer to replace instruments or sterile drapes rather than risk introducing infection. Prepare a new sterile field. If necessary, a new sterile field should be set up. Aseptic technique requires that any sterile field be free from potential contaminants. What are the advantages of using a capnograph during anesthesia, and how can it assist in detecting early signs of respiratory or cardiovascular complications? Answer: a capnograph measures the concentration of carbon dioxide in exhaled air and is essential in monitoring the patient's respiratory function during anesthesia. The main advantage of using a capnograph is its ability to provide real-time feedback on the patient's ventilatory status, which is crucial in detecting early signs of respiratory or cardiovascular complications. For instance, a sudden drop in the end tidal echo can indicate hypoventilation or inadequate ventilation, potentially signaling a blocked airway or insufficient anesthetic depth. On the other hand, an increased echo could indicate hypocapnia, which might result from poor pulmonary ventilation or an overly deep anesthetic plane. Additionally, capnography can reveal cardiopulmonary issues as it provides a direct link between levels and the patient's circulation. Capnography combined with other monitoring devices like pulse oximetry and ECG enhances patient safety during surgery and anesthesia. The American Veterinary Medical Association (AVMA) and American Society of Anesthesiologists (ASAP) recommend the use of capnography in any patient undergoing general anesthesia to improve intraoperative monitoring and early complication detection. Explain the critical parameters a veterinary technician should monitor in a patient recovering from surgery and discuss how to assess and manage post-operative pain. Answer: after surgery, it is essential to monitor multiple parameters to ensure the patient is recovering properly and to identify any complications early. Critical parameters include vital signs. The veterinary technician should monitor heart rate, respiratory rate, temperature, and blood pressure to ensure the patient is stable. Bradycardia, hypothermia, or abnormal respiratory patterns could indicate complications such as anesthetic overdose, hypovolemia, or systemic infections. Wound care. Proper monitoring of the surgical site is essential to detect signs of infection, hematoma, or dehiscence. The technician should look for increased swelling, discharge, or redness, which could signal complications. Post-operative pain management. The technician should assess the patient's pain level using subjective assessments, e.g., behavior, posture, vocalization, and objective signs, e.g., heart rate, respiratory rate. Effective pain management includes the use of multimodal analgesia combining opioids, NSAIDs, and possibly local anesthetics. Monitoring for adverse effects like sedation or respiratory depression from opioids is important. Discuss the role of NSAIDs in pain management for veterinary patients and explain their potential risks and how to minimize them. Answer: NSAIDs, non-steroidal anti-inflammatory drugs, are commonly used in veterinary medicine for pain relief, particularly for musculoskeletal pain, post-operative discomfort, and inflammatory conditions. These drugs work by inhibiting cyclooxygenase COX enzymes, which are involved in the production of prostaglandins, substances that cause pain, fever, and inflammation. The advantages of NSAIDs include effective pain management and a low risk of sedation or respiratory depression compared to opioids. However, they do carry risks, particularly regarding the gastrointestinal (GI) system, renal function, and liver health. NSAIDs can cause gastric ulcers, renal failure, or hepatotoxicity, especially if used inappropriately or in patients with pre-existing conditions. To minimize these risks, pre-anesthetic screening should be performed to assess liver and kidney function, ensuring that the patient is suitable for NSAID use. Use the lowest effective dose for the shortest duration possible to minimize adverse effects. Consider co-administering gastroprotectant (G) omeprazole in patients at higher risk for GI complications. Describe the methods used to assess a patient's response to post-operative pain and explain the role of the technician in adjusting pain management strategies. Answer: Post-operative pain assessment involves both objective and subjective methods. The technician should monitor the following: behavioral signs. Changes in posture, increased agitation, or restlessness are signs of discomfort. In contrast, a calm, relaxed posture may indicate effective pain relief. Physiological signs. Elevated heart rate, increased respiratory rate, and elevated blood pressure can indicate pain or distress. Response to touch. A patient that reacts negatively to palpation of a surgical site may indicate pain. Once pain is identified, the technician must adjust the pain management plan. This may include altering the dose or type of analgesic, incorporating additional NSAIDs or opioids, or adding local anesthetics or nerve blocks to further control pain. The American Veterinary Medical Association (AVMA) recommends that pain should be managed in a multimodal manner, combining different classes of analgesics to target various pain pathways. Regular pain assessments are crucial as pain levels can change during the recovery process. How does proper wound management after surgery contribute to minimizing infection risks and promoting healing, and what guidelines should a veterinary technician follow when caring for surgical wounds? Answer: healing after surgery. The steps involved include monitoring for infection. Surgical sites should be observed for signs of infection, including increased redness, swelling, or discharge. The technician should apply sterile dressings and change them regularly to reduce the risk of contamination. Suturing and bandaging. The choice of suture material and technique can impact wound healing. Absorbable sutures should be used in deep tissue, while non-absorbable sutures are suitable for external wounds. Bandages should be applied in a manner that supports the healing tissue without causing pressure or restricting circulation. Guidelines for wound management are provided by the American College of Veterinary Surgeons Act, which stresses the importance of maintaining a clean, dry, and sterile environment to reduce the risk of infection. Regular reassessment of the wound and adjustment of treatment protocols are also essential for optimal recovery.